to take the opportunity to welcome all of our guests from the public for this special work session of the Board of Douglas County Commissioners to discuss the decision that was made by the Tri-County Board of Health on Monday evening. That specific decision that was made by the Board of Health, it had a lot to do with eliminating the opt-out provision that was negotiated in good faith by this board last year. So I'd like to begin with some comments from our Board of County Commissioners, and then I'd like to ask our County Attorney, Lance Ingalls, who is here with us, to walk us through the legal framework associated with both our Public Health Department and current status associated with the opt-out. Commissioner Teal.
I guess the comments I'd like to share to start us off are just my disappointment in the Tri-County Board. I really felt like what we heard expressed was very much an us and them mentality, or at least perhaps I don't think it, but we certainly heard it in some of the comments from board members from other counties. I really do feel like we are the them in that equation. I do not feel like Tri-County sees us as an equal and valid partner. Perhaps we have staff with Tri-County who do, but it was just very apparent to me from the board meeting that I watched from start to finish that we are no longer viewed as an equal partner by Tri-County Health's board.
Thank you, Commissioner Thomas.
Commissioner Teal, thank you for those words. When I listened, as well as you did, to the meetings last week and this week, I actually don't feel that Douglas County is welcome. These concerns started last year in July when Commissioner Layton and Commissioner Partridge and I had been assured by Dr. Douglas when he was talking about a mandatory mask order in July of 2020 that it would not include Douglas County because our numbers were very low. Yet in the Board of Health meeting after Dr. Douglas made his recommendation to only require masks for Adams and Arapahoe County, an Adams County representative on the Board of Health made a motion to mask up all three counties. And that's when it became really clear to me as one of three that this was a very political issue, that they weren't listening to the health expert in the room. And that's why I made the motion to leave Tri-County in that July meeting that the commissioners had, and Commissioner Layton and Commissioner Partridge joined me in that motion. We, as required, did our letter that we were going to exit Tri-County Health in a year. They came to us wanting to see if there was a way we could stay together. And we negotiated in good faith for 4 months. Many people, our attorneys, our managers worked to get that done. And on November 6th of 2020, Rosanna Reyes, who is the board chair at the time of the Tri-County Board of Health, signed that opt-out order so that any county could opt out of any public health orders that they felt were contrary to the needs of their citizens. Douglas County then rescinded our request or our direction to leave Tri-County Health. I believe that we have been double-crossed, that we negotiated in good faith, and that the time has come for this Board of Commissioners to look at what really is the best method of delivering public health services to our residents. Thank you.
Well, I would just like to thank this Board of County Commissioners and for the leadership in Douglas County, as well as all of the moms and dads, grandmas and grandpas that share concerns and have questions about public health delivery for the safety of their kids and also for their right to have personal decision-making around those decisions. I will tell you as one commissioner that my view of Tri-County's decision to eliminate the good faith negotiated opt-out provision unilaterally was a breach of the agreement that we had with Tri-County Health. That was a condition precedent for us remaining with Tri-County Health, was that a measure of local control regarding public health orders would be retained by the counties. And I would just like to say, no doubt, we deeply appreciate public health professionals, doctors, nurses, hospital administrators, and directors for the incredible work and information and collaboration that they've had with elected leadership for the last 18 months. We look at that data and hear from them through our staff on a daily basis. We are led by that data, and it is critical to us to continue to have public health expertise that informs our processes. That said, when an agreement is negotiated in good faith and that agreement is unilaterally breached by one entity, we have very little option other than to pursue our own course in light of that breach. So I would just like to again assure moms and dads, grandmas and grandpas that in Douglas County, you can have cost-effective, efficient, exceptional public health services and also retain your freedom and your decision-making ability around your family's healthcare decisions. And I'm looking forward to the discussion today around options that Douglas County may have to continue those public health services, primarily around one theme, which is no gaps. At no time do we expect to have any gaps or any interruption in services for our citizens. So for every citizen that is on this call and the 380,000 citizens that this board represents, they should experience a continuity in terms of delivery of exceptional public health services, and that is my commitment. My other commitment is that those public health services will be science-led. It will continue to be driven by data and driven by expertise. One challenge of many that we saw over the last 18 months was a war of misinformation, where people saw national news reports and memes on Facebook and other forms of social media that generate revenue through advertising, clickbait. And unfortunately, that information may or may not have been correct, and people have emotional reactions to what they see. I just want to ensure the public that our decisions will continue to be driven on actual facts and accurate data from the experts. So unless there are additional initial comments from the board, I'd like to ask our county counsel, Lance Ingalls, who is on the call, to provide us a bit of a history in terms of the legal framework for our relationship with Tri-County Health and the county's obligation statutorily to have a health department. And then, Mr. Ingalls, if you could provide us the legal framework that we're in right now with regard to the current opt-out or lack thereof associated with the recent Tri-County decision. Mr. Ingalls?
Thank you, Mr. Chair. Can you hear me okay?
We can.
Okay. I'll do my best to cover what you've asked. We're not in the same building or even part of the county right now, so I'm listening and I'm going to react as best I can. If I miss something, please just remind me and I'll try and come back to it. The history of our Douglas County's time in Tri-County Health is roughly a 50-year period. We joined Tri-County Health the same year that Jefferson County left Tri-County Health to become its own entity in roughly 1970. I don't have that date in front of me, but that's pretty darn close. And we've been in Tri-County ever since. Most of the county's growth obviously occurred starting in the 70s, and so we've changed quite a bit over time since then. Fast forward to today, Tri-County Health is made up of the three counties, Adams, Arapahoe, and Douglas County, and it has been that way for some time. The process of being in a district health department, and Tri-County Health is a district health department, is a county has to want to join the district and the district has to accept them. And so again, that was done many, many years ago. The process for leaving a district is similar in kind, although a county can simply provide notice of its intent to withdraw from a district. That is a 1-year notice requirement by statute. And then a county is free to do whatever it believes is best next. A county must have a health department. It can be an individual health department or a district health department, but it's not optional to have one or not. You must have one. So on July 10th of 2020, at the request of the board, I did mail notice to the attorney for Tri-County Health expressing and notifying Tri-County Health of Douglas County's intent to withdraw from the board. The three of you have recapped those events nicely, and I won't repeat much. We did negotiate with Tri-County a period of time to stay in and see if we could work out an arrangement that would work longer term. But that agreement was twofold. One, they would have a policy that would allow the counties to opt out of various county-wide public health orders. And in exchange for that, we would extend the deadline or rescind our notice to allow us to stay in through January 1st of 2023. As you pointed out, Tri-County has elected not to move forward with that agreement any longer. They did that earlier this week, and that leaves you to direct me what you want to do next. So I think there's a very good argument and a very strong position that we can still rely on that July 10th, 2020 notice. If Tri-County Health agrees with that position, it's fairly simple. We simply agree on a new date that is mutually acceptable, and we won't have to start over with any notice. That should be what happens. There's no reason that shouldn't happen at this point, and there's no reason we expect them not to agree with that position. Did I miss anything that you asked me to cover, Commissioner?
Mr. Ingalls, I think that was an excellent legal recap. Any questions for County Counsel?
Mr. Ingalls, I just have one question. Did I hear you say that you do not have any reason to believe that Tri-County would not work with us on an agreeable date for us to leave and start our own health department? Did I hear you say that?
That is my understanding, Commissioner. I know a lot of conversations have taken place between high-level county staff and high-level Tri-County health staff. And there is a belief, at least at these initial stages, that we're going to be able to agree fairly quickly on some parameters that should work for both of us. And I trust the people that are having those conversations. I'm giving everyone the benefit of the doubt, but yeah, I'm very hopeful from what I've heard that what I've told you is likely a map to resolving issues and resolving them quickly.
Thank you. So with that in mind, can you explain to us what our roadmap would be then as commissioners, should we decide today that we would like you to continue to negotiate with Tri-County Health to determine a mutually acceptable exit date? Then what do we need to do?
Yeah, regardless of timing, the process for, let's just say for a second, we're going to create the Douglas County Health Department. The process for doing that, so ignore the timing for leaving Tri-County Health for the moment, is the board would pass a resolution creating the Douglas County Health Department. It's by statute called the local health agency. It can be a district or a county, but I'm calling it a county. So the board would pass a resolution to create the Douglas County Health Department. The passage of that resolution would begin the term of the Douglas County Health Department. You then have 90 days, up to 90 days. You don't have to wait 90 days, but you appoint a Board of Health. The Board of Health would be as defined by the creation document. The Board of Health, once appointed and created, they then have some additional statutory duties that helps them conduct business. So one of those early duties is to select an executive director for the health department. So the first step is to pass a resolution creating the department. The next thing that needs to happen is the actual appointment of a Board of Health, and then the Board of Health has some additional responsibilities.
Thank you, Mr. Ingalls.
Commissioner Teal?
Actually, Commissioner Thomas asked the questions that were foremost in my mind, so thank you, Commissioner. I have no questions.
Thank you, Commissioner Teal. And I just want to step back to some of the conversation that we had around this recent decision by the Board of Health on Monday. Lance, I articulated to you my perception that a condition precedent of us remaining with Tri-County Health was that we would retain local control. And that was memorialized in the agreement that Commissioner Thomas referenced. Would you agree that the unilateral decision to remove that local control is a breach of that agreement?
I do agree that we had an agreement, and part of that agreement was that we would have an opt-out ability as a county. And since that time, Tri-County Health has rescinded that particular policy. So I think there are very strong legal arguments that the agreement we had to stay in has been rescinded, and we have the ability to make new decisions.
Well, I appreciate that, and I believe that all three of us are in agreement that that legal advice is sound. Again, I think the overarching theme associated with addressing a global pandemic is that each County is different. We are very different than Adams County. We're very different than Arapahoe County. And we've had phenomenal metrics primarily because of our citizens. Many of those on this call, moms and dads, have done the right thing by themselves, by their kids, to keep their kids safe. And we respect that decision making. We've tried to balance both saving lives and livelihoods for 18 months. It is both. In terms of moving forward, I'd like to just ask you, Lance, if you can provide us any additional information around continuity of services and to bifurcate perhaps between governance and services. My understanding is that while local control would remain with a Douglas County Board of Health through new orders issued by that Board of Health, that there would also at the same time be seamless continuity of services contracting with Tri-County Health or other entities that would provide the same or better services. Is that a fair statement?
That is my understanding. You may want to ask a similar question of the county manager or the fine folks he's got assigned to this issue. But yes, there has absolutely been discussions about continuity of services and absolutely no gaps. So there are a number of ways to accomplish that. One, and these all need to be worked out. And so I can't tell you we have final answers, but I can tell you staff has heard loud and clear that you as a board will not accept gaps in service for our citizens. So one of the conversations we need to have, and it has started at least at the administrative level, is Tri-County Health willing to contract for the services they have been providing anyway, at least through the end of this calendar year, if not beyond that. Those terms and conditions need to be worked out, but Douglas County has paid for services through the end of 2021 already. Tri-County Health has that money, they have those employees, they have that staff. We are hopeful and we are anticipating that that minimal agreement can be reached. But staff has heard from the board, you don't want any gaps for our citizens. And I know that very good people, far better than I, are working on that issue.
Mr. Ingalls, thank you for that. I will take your recommendation and turn it to our county manager, Doug DeBoard, to provide any additional insight either through himself or staff. Doug?
I don't think I have anything else to add of substance. We don't have an agreement, but we're working to implement what the board wants for sure. We'll see what happens. Do you have any questions for me? Well,
it's fair statement that Lance raised that we are in fact paid through the end of this year contractually with Tri-County Health.
Correct.
Okay. Well, I think that's an important point that I believe my colleagues would share, that there would be an expectation that Tri-County continue to render services and ensure that there is, again, there are no gaps in services for our citizens. Commissioners, any additional comments for either Lance or Doug?
Doug, since you're on the call and you may have been having conversations with Tri-County Health, do we have any understanding or indication of how Tri-County Health intends to enforce the current mask orders that are in place in Douglas County going forward?
No, I do not have a good understanding of that. Would be happy to reach out to them and learn more.
I think that would be important for us to know about if they are going to enforce their requirement in schools and daycare centers. And if so, what that looks like. Do they have the authority, Tri-County Health, to revoke a daycare's license? Thank you.
Commissioner, was that a question for me? I apologize.
No, I had asked Doug if he's going to reach out to Tri-County Health, if he could get that information, but do you have an answer to that question?
Indirect, I have part of the puzzle, I guess. I know historically Tri-County Health's desire on all of its orders has to get voluntary compliance. So at least as a first step, they are not intending to be, or at least historically, they have not intended to be, and they have not approached things heavy-handed. So they would not start with enforcement, and they would not start with any suggestions even of a breach of a license or anything else. That's been their approach. I have no reason to believe they would take a different approach. As far as daycares, they do not license daycares. That's actually a state function that does not go through Tri-County Health. What Tri-County Health does is they do inspections that assist with the licensing process. So without doing the research and without having any idea that question was going to come up, I do not believe that Tri-County Health could revoke a license for a daycare. However, they would have enforcement authority, and if they had specific concerns, they would have the ability to close, at least temporarily, a daycare if they felt that was an appropriate step. But again, historically, they have not started with any approach that's that heavy-handed.
I certainly hope they continue that, because if they close a daycare center, then parents are not going to be able to go to work. And we do not need to start this in the county. So thank you for that information.
You know, I would just reiterate that the level of confusion that's created by inconsistent, broadly applied mandates creates a lot of commotion for our parents, grandparents that are taking care of kids, school administrators across the private, charter, and neighborhood school spectrum. Our intent is to avoid confusion and to provide a pathway out of these challenges. But one question that I would have for you, Lance, is whether or not the decision made by Tri-County Health on Monday is in fact enforceable at all, because it was unilaterally made in contravention of our agreement with them. I know that there are school administrators, private charter, and certainly the district that are contemplating whether or not Tri-County had the ability to revoke our opt-out. Is it possible that we might take the position that opt-out, the removal of the opt-out is void?
Well, ultimately, I'm going to leave it up to the board how it wants to direct me in my office. We certainly have a very competent office to pursue legal issues such as that. If the board elects to challenge the rescission of the policy and or the issuance of the order, we'll get on that right away. My hope is that with the discussions that have already taken place at the administrative level, those conversations will become less necessary, if not unnecessary, because if we can mutually agree on the bigger issues about Douglas County's future and going its own direction, it won't be necessary to get into that other detail about do we have an order or not from Tri-County. So it's not impossible to challenge those orders. It's not simple. We have a very good staff, and if that's the direction the board wants to go, we will do it post haste.
Well, the reason I raise that is a practical one. I think parents are getting emails being told that they have to mask up their 2-year-olds today, and school administrators, private charter and neighborhood, are being told that they have to instruct everyone over the age of 2 to wear a mask. So I do think some fairly immediate decision-making needs to occur with regard to where people stand, as certainly things change day by day. So as one, I would certainly accept the motion to immediately challenge the validity of the Board of Health's decision to remove our opt-out, if the board is so inclined.
If I may, Chair.
Please.
In all honesty, I can see some merit in that course of action. My interest is pursuing forming an independent board of public health for the county, as well as an independent health department for the county. As far as the validity of that order with Tri-County, in my opinion, this is a deal that's gone south. I helped a customer once end a 60-year business relationship with a vendor. These things occur in business all the time. These things occur in our personal lives all the time. This is an occasion where in governance, and thank you so much with your comments about the difference between governance and services provided. I think that was a very important statement and a very important thing that we all understand. But in my opinion, the relationship we've enjoyed with Tri-County for 50 years is no longer a beneficial relationship. So I appreciate your comments of challenging the validity. I have to confess, I'm much more interested in taking actions to pursue our own course of action and maintain a cordial service relationship with Tri-County for a period of time.
Thank you, Commissioner Teal. Commissioner Thomas?
I will reiterate what Commissioner Teal just said. I would prefer that we look downstream and we figure out how we get out from under Tri-County Health as soon as possible, and that we spend our time and effort focusing on building a new health department without missing any services for our residents at the same time. But it's my understanding that we need Tri-County's health, their cooperation in order to leave quickly. My concern is that if we start taking some kind of legal action against Tri-County Health, that the desire for them to work with us to help us create our own Board of Health and for them to continue to provide services until we have our Board of Health and our health department completely standing, any incentive they have to work with us disappears. I think we need to keep our long-term goal in mind, and that is to create a Board of Health and a health department in Douglas County that is responsive to the needs of our citizens.
Thank you, Commissioner Thomas. So I'm going to continue to raise this because in my view, there's no reason we can't do both. And I imagine many citizens on this call would probably agree with that statement. I think it was very clearly articulated to us that they are under a contractual obligation based upon the monies they've received to continue to render services through the end of this year. I would welcome and appreciate the collaborative desire to maintain continuity that has been represented to us by Tri-County Health. And I will continue to rely on those written statements from Board of Health or Tri-County Health directors that they will cooperate with us. But at the same time, I think it would be entirely appropriate for this board to interpret their action as void and unenforceable based upon the agreement that we reached with them that allows Douglas County government to opt out of public health orders. At the same time, I will agree with my board that the priority for today is to be able to move forward with forming our own local public health agency, the Douglas County Public Health Agency, and determining how we can best do that. So I certainly support my board in that regard. I'm just cognizant of the number of parents and administrators that are probably on this call wondering what's going to happen in the interim. Thank you.
May I please ask a few questions just to clarify a little process with the county attorney?
Please.
So question number one, Mr. Ingalls, would be, if I understand the process right, were we to desire to form our own health department in Douglas County, our first step would be a resolution directing staff to do just that, to form a health department for Douglas County.
That is correct, sir.
So inherent in that resolution, we would probably want direction to form a public health board for Douglas County.
Yeah, that could be done concurrently. That could be done by separate resolution. But yes, step two is absolutely to create and appoint the Board of Health.
And if I recall your earlier comments, you said that we have up to 90 days to form that board.
By statute, yes.
However, it is up to 90 days to do so, but it is not we must take 90 days to do so.
Also correct, yes.
So within that 90-day window, let's say whether it's day 1, day 10, day 20, we can form that public health board for Douglas County, Colorado.
Yes.
So once that public health board is formed for Douglas County, Colorado, is it not true that they then have the full authority of a board of public health within Douglas County, Colorado?
Yes, sir. Once they're validly created, they are the Board of Health for Douglas County. And assuming that the issues wrap up as we expect with Tri-County Health, then upon your creation of the Board of Health, you can determine exactly when they take full force and effect. But that's the nature of creating a health department and appointing that board, is they would then be in control. There's still the notice issue to resolve, but I still believe that that will be cordially and quickly resolved, because I trust the players to get that done.
So once the Board of Health is formed and they meet, Tri-County Health is no longer the Board of Health for Douglas County, Colorado. It is that Douglas County Board of Public Health.
That's correct.
Well, thank you so much. I very much appreciate you clarifying that for me. That actually helps me greatly in terms of what I would like to discuss, Chair, at the pleasure of the board in terms of direction for staff.
The additional comments?
Commissioner Teal, I appreciate those questions you've asked. I think we may have started this conversation Monday morning about what a Board of Health might look like. And I certainly, again, do not want to have staff spending time trying to undo something which might not be successful, but rather spend time getting a board of, the resolution done, and then a Board of Health, while working with Tri-County Health to deliver the services that you, Abe, have talked about. So there is no gap in services for our citizens. So thank you.
Yeah, you bet. I mean, obviously, in my intent for those questions kind of goes to what you asked earlier in terms of the difference between services versus governance. And I think I hope my question helped clear up for you too. It certainly did for me. My questions to the county attorney, answering those concerns that I had in terms of actual governance.
I think that's great. You know, as we process some of these discussions, I'd be remiss if we didn't take an opportunity, Doug, to reflect upon today's data as it relates to COVID or any of the associated variants, including Delta. I'm wondering if you or perhaps Troy could provide today's current data associated with hospitalizations of all people 0 to 18 in Douglas County.
Yeah, thank you, Mr. Chair. Let's give Troy a minute. We also have John Serbach on the line to discuss current hospitalization. And if it's acceptable, maybe we could start with John while Troy's pulling that up.
Please, thank you.
Good afternoon, Commissioners. I just have a few key points. Nothing significant has changed since my report to you at close of business yesterday. Of course, we don't have close of business today. But at that time, the hospitals in Douglas County were reporting no pediatric hospitalization. I would like to address the continuity component. We've worked with our peers and associates in a variety of fields and can assure you that whatever your decisions are, the emergency preparedness and response component will continue to provide services until such time or unless Douglas County takes that over completely. So there'd be no compromise as it relates to the EPR service delivery. Back to the key considerations, hospital staffing has and continues to be something that is causing a great deal of concern. Certainly, it's reasonable to assume that attrition and burnout have taken a dynamic impact on the workforce, and they continue as we are involved in a pandemic campaign, truly with no clear end in sight at this time. But we are incredibly blessed to have the hospitals that we do in the metro area. They've become quite well versed in medical surge. Their capabilities, they've modified them and changed them to address the special needs associated with this particular pandemic. They've developed a number of decompression tools such as reducing electives and divert and so forth. So while census levels are increasing, it's important to note that there are collateral reasons for that outside of COVID. Certainly RSV is one of those. There's also been quite a significant increase in other than COVID hospitalizations. And so I guess what I would report to you is the hospitals are doing a great job of managing and self-managing. I think that they're, and I'm not trying to speak on their behalf, but I certainly would sense that they're wanting to self-regulate rather than be regulated in terms of they know what's best to maintain quality care service delivery. I'll answer any of your questions if you have them.
John, for those that are listening in, could you just share your title and role with the county, please?
So I'm an incident commander, all hazards incident commander, but I'm assigned to the Office of Emergency Management, where I'm monitoring a number of things, medical surge being one of them.
Thank you, John. And I would just like to reiterate my gratitude to you for continually providing that daily expertise and information and data that inform our decision making. And I just want to point to the chart that Troy just pulled up, which is the COVID-19 weekly hospitalizations by age group. And Troy, I'm looking at the bar on the far right and just want to reiterate my understanding that as of today, there are 0 hospitalizations for ages 0 through 18 in Douglas County. Is that accurate?
Sir, who are you at?
John, you can confirm that if Troy's on mute.
I'm sorry, I do get those numbers from John. So John did say there are 0 minors, youth in our hospitals, in our 5 hospitals, sir.
Okay, thank you.
Sir,
And
that was updated just prior to this call. We were able to confirm that just before this call, sir.
A total of 0 hospitalizations, 0 to 18. Well, we certainly are watching cases. We understand lagging indicators, but as we've seen for the last 18 months, the severity certainly has not impacted this particular age group. I believe we still have just 1 death, 0 to 18, over the course of the pandemic. Is that accurate?
Sir, that's the report we have.
Is 1, and we mourn that death. Any death is too many, but certainly that's instructive of how people are being impacted through this pandemic. Thank you for that exercise and taking a look at the expert data that you provide, John, and again, my appreciation for that. I'll bring it back to a discussion among the board associated with the conversation related to our local public health department. Let me just add that I would certainly accept the motion that would direct our county council to send a letter regarding notice and creation of our own local Douglas County Health Department, and to direct our county manager to work with counterparts on mutually acceptable but a speedy separation that would allow for local control over public health and a continuity of services.
So moved. I wish to speak in favor.
Second.
And I'm going to ask, we do have a number of folks on the call. If you're able to mute yourself so we can continue to hear, we'd appreciate it. There is a first and second on the floor. Is there any discussion? Please, Commissioner Teal.
Thank you, Chair. Yes, I am in favor of this motion to go ahead and direct the county attorney to notify Tri-County Health, specifically with the
Hello, this is Troy Denning. It appears you are muted.
Mr. Teal, we lost audio in the middle of your motion.
All right. Well, I'd like to speak in favor of the motion of directing the county attorney to inform Tri-County Health that we do intend to depart from Tri-County, with the provision that that notification also include recognition of the fact that the July 2020 notification is in fact still valid, and that we are therefore beyond the 1-year notification requirement. And of course, I ask for the support of my colleagues.
Thank you. I would like to also add that we have heard that Douglas County has paid Tri-County Health for their services through the end of this year, and that we look forward to working with them as they continue to provide services for our residents, while this board creates a board of health that will provide the governance while they provide the services. I would just like to add that I got an email last night from a friend whose 15-year-old daughter is struggling. They had to call 911 last week. The daughter was put in an inpatient facility. She was let out to go to school one day this week, but she had to wear a mask. And she could not communicate with her teachers, and her teachers could not communicate with her. And my friend begged me that we take care of our kids. And so I am here with all the parents telling you that we have heard you, and we are doing everything we can legally to make your kids under your control, not a board of bureaucrats. Thank you.
Thank you, Commissioners Teal and Thomas. I greatly appreciate the phenomenal support that this board in Douglas County has for its moms and dads that are struggling and have had a challenging last year. You are the true heroes of this pandemic. I would offer up a friendly amendment to my colleague's motion that we clarify, consistent with County Council's advice to us, that as a result of the direct action to unilaterally remove our opt-out on Monday, that was a conditioned precedent of us remaining in, and that in fact breaches our agreement and revives the July 11th, 2020 notice to, I'm sorry, the July 10th, 2020 notice to withdraw.
I agree and take that as a friendly.
Okay. I will also ask my board, consistent with their comments, for an additional friendly amendment that we issue a statement and we ask our county manager, Doug DeBoard, to provide information in concert with Wendy Holmes, our public information officer, that educates the public on the action that we have taken today, and also includes our interpretation that the unilateral mask order on Monday is not enforceable.
I agree and take that as a friendly.
Thank you. So we have a first and second on this motion. All those, is there any further discussion on any of these motions or friendly amendments? I have a first and a second on the motion. All in favor signal by saying aye.
Aye.
Aye. And that motion passes 3-0. County staff, I just want to thank you for your engagement today in this special work session. Do you have any additional comments, thoughts, or input that would be helpful for us today?
Well, given the board direction, a couple of matters, Mr. Chair. One is on Tuesday morning, the board has afforded a lot of options related to the formation of a board of health, and we can have a work session Tuesday morning to further go into that. As well as there is, in Lance's opening comments, he talked about a resolution that would need to be taken. Just looking at their calendar, sort of to formalize the direction you're headed, that would tentatively be, I'm proposing Tuesday at 4.
Thank you, Mr. DeBoard. Do any commissioners have any challenges associated with taking up this action next Tuesday at 4 p.m.?
Sure, I'd like to make a motion to direct staff to create a resolution withdrawing from the Tri-County Health Department and forming a Douglas County Public Health Agency that we would schedule per the county manager's advice at 4 o'clock next Tuesday, which I mark as the 7th of September.
I have a first. Is there a second?
May I just ask a question first? So Doug, when I look at our calendars, I see that we have a liquor authority hearing at 1:30. Is there a reason that we could not schedule the meeting earlier so that we have time for comment instead of us waiting from maybe 2:30 until 4? I'm just wondering if
Yeah,
it's
possibly, and happy to work with the board on that. You have 3 licenses, as I understand it, and could take up to an hour and a half. And I was sort of thinking about the traffic in and out. Based on this call, there seems to be a lot of interest in this topic. So, but, you know, if the board's feeling like you ate your Wheaties, maybe we could schedule it earlier, 3:30.
I'm sorry, I didn't realize we had three. We rarely have three at one time, so I apologize. But I just wanted to clarify because we've got over 200 people on this call now. If people want to show up, I'm hoping that we're not there until midnight for all the individuals who might want to speak. That's all. But 4 o'clock is fine.
What's the board's pleasure?
I mean, I'm okay amending to the direction being as soon as possible, concluding the liquor license authority in terms of the time.
We will have to post that meeting 24 hours of the actual meeting. So it would be appropriate to identify a time if the board would like to do that.
In that case, the motion stands, and I ask for a second.
Second.
I've got a first and second. Is there any further discussion? All those in favor signal by saying aye.
Aye.
Aye, and that motion carries 3-0. We will hear that next Tuesday at 4 p.m. For the good of the cause, is there any additional discussion from staff or from the board on this issue today?
Yes, sir. I need a clarification. So Tuesday, the 7th at 4 o'clock, are you wanting a final version of a resolution? Or is that when we're going to work out some of the details, what you want to see for your Board of Health? What are you wanting ready to go on Tuesday, the 7th?
Here the motion with the final version.
It's a final version of our resolution to create our own health department. Is that correct?
Correct.
Okay, thank you.
I would agree that I think our citizens have been delayed enough by government, so the sooner we can get that accomplished, the better. Lance, did you have any additional questions for us?
No, that was the main one I needed answered. I will solicit individual input on what the final resolution will look like, so it is as final as it can be before that meeting without being able to convene the board to discuss it.
Okay, thank you. Any other comments or questions from the board or staff?
No, sir.
I would just like to add to all the parents and citizens on this call, you have been heard, so thank you.
You know, I would echo that comment, and if there's any doubt, you will receive correspondence and public communications associated with our interpretation of that invalid mask order from Monday that attempted to remove your freedom to choose and make decisions about your own healthcare decisions. I encourage you to interpret that accordingly. With that, I will conclude today's special work session and thank everyone for their engagement and attendance today.
Thank you.
Thanks, guys.